All right. Welcome to the MaxLove Project Podcast with Audra and Samantha. And we are talking to our dear culinary medicine dietitian, Lexi Hall today. Lexi, you have been really a founding partner in MaxLove Project's culinary medicine program. I mean, by the time you came on board, we were doing cooking classes and things like that, but you took us up like 10 notches, and you have been such a blessing to our program and our families. And so we're going to talk to you today about who you are and how you came to this work, and what you do with MaxLove Project, and probably a bunch of other things that Sam and I are interested in. This is just a starter conversation. So Lexi, I want to turn it over to you to introduce yourself and kick things off.
All right. Well, thank you for that introduction. I'm so happy to have had the chance to do what I always wanted to do with culinary medicine, because it's such a near and dear, it's who I am, it's what I am. And you allowed me the platform to get going on it. So I am incredibly grateful to be here in this space with you as well. There was the desire to be here and doing this, but being able to have the platform was huge. So it was everything. So thank you. So a little bit about me. I came across dietetics a little later in life, actually. I was one of those people who didn't know what they wanted to do when they grew up, and one of those people who kept trying different things. Believe it or not, I actually tried landscape architecture at one point. I tried business marketing at one point. I tried advertising at one point. And at one point, I was a graphic artist, but nothing stuck. Nothing was meaningful enough for me to go all the way. And I had taken a nutrition class, basics nutrition class at a community college. And it was like the sky opened up, the sun came out. It was just all there was. And then I had kids, and I had a child that was born with a lot of nutrition related issues. And so, in the quest to find something that would bring her really heavily painful issues to a resolution, I ran into a lot of roadblocks, which was really frustrating. Roadblocks with doctors, roadblocks with nutritionists, roadblocks with people. Finally found people, as we often do, as we search for these things that are going to help our kids. And it was like, that's what I want to be for other people. I want to be somebody that's going to bring help and not judgment and resolution, as much as I possibly can. So that's what started me down this track.
Such an amazing story, Lexi. I mean, I think as a mom who was brought into this space through my child, like, that is a part of your story that has always really resonated with me, and I think something that resonates with our families too. Like, that is such a huge motivation. I think one thing that's always inspired me too about you is that you didn't take no for an answer. I remember you telling this story about how a GI doc told you that your daughter's pain and challenges had nothing to do with food.
Not only did she tell me that it had nothing to do with food, but she literally held up her hand in front of my face and says, "Mom, this is where you stop and this is where I begin." And then just proceeded to write 7 different prescriptions. And I walked out of her office feeling this big, that I was harming my child by trying to do a nutrition intervention. I only felt that way for a day, honestly, but really, I walked out of her office thinking, and I was frothing at the mouth to see this woman, because they had really touted her expertise. She was Stanford trained, and she had a doctorate in dermatology. She had a doctorate in gastroenterology. She was the one you wanted to see, and I had waited months to see her. And I walked into her office with a stack of my notes and medical records and symptoms and interventions we'd tried, and she just 100% dismissed everything within 2 minutes of the conversation. And I got to the pharmacy to start filling these scripts, because that's how I felt at that moment. And as I'm reading the small print, and it says, you know, suicidal tendencies, it says nightmares, it says all these things. And I'm like, so you're telling me that I have found the food triggers for my daughter's problems, but I shouldn't withhold them from her. I should give her this medication that's going to give her suicidal tendencies and nightmares and all this stuff. And I'm thinking, I'm not wrong. I am not wrong. I am, and it would just, it goes from there. There's a lot of doctors out there who do amazing, amazing things, but there's a lot of doctors who also follow a algorithm that equates
Yeah.
to a pill. And thank God we have some of these pills because they're life-saving. But there was a House resolution that was passed in 2021, and it was after they had started a entire conference on the fact that 8 of our top 10 chronic diseases are impacted by nutrition, and how it is the responsibility of every healthcare provider to discuss nutrition in their practice.
Mhm.
It gave really a lot of evidence to the credibility that nutrition, it may not be 100% fixed, but at the same time, it makes a difference. And
Yeah.
all of us should be in this space and promoting it.
Yeah. And I'm wondering, what have you seen develop or grow or change from when you went through this with your daughter in regards to, food as medicine and nutritional interventions for, kids and doctors and the practices?
I've seen the whole gamut, honestly, Sam. It's
Hmm.
sadly, you still go to doctors today where the doctors have 12 patients in a 4-hour period,
Hmm.
and you get a discussion, and the doctor's a little bit um, jaded by the issue
Yeah.
and thinks, just makes a decision in the head that the patient is not going to listen to nutrition advice, or they're not going to adhere to nutrition advice, and they just say, oh, take this pill, then you don't have to worry about
Right.
it. And so I see it with diabetes a lot, which is really sad to me because there are so many preventative discussions that can be held long before a patient ever gets to type 2 diabetes. But the reflex motion is to a pill. Um, but then again, I've also seen a lot of doctors that do talk it. I've seen doctors at CHOC, Children's Hospital of Orange County, that there's cardiologists there that I worked with that absolutely says food first, medicine first. I've seen rheumatology, the doctors in rheumatology at CHOC, definitely food first. Let's see what we can do about that before we progress to medication. So it's there. Absolutely, it's growing, but it's not everywhere.
Right. Yeah. No, I think it's really powerful. And to hear someone like you who's so well versed, in the space and the fact that you can talk to doctors, that you're trained, advocate that food is medicine, I think you're just a resource that needs to be replicated just for that fact. I think there's a lot of families, even the pediatric cancer space, who are looking for that kind of support to say, you know, what should I feed my child? What would help? And just like you said, in an oncology clinic, you're not necessarily going to get that at every place. There's different experiences at different hospitals. But I think if we could segue into what is your idea of food as medicine, and maybe we narrow it down to oncology and how you've approached the idea of food as medicine within the pediatric oncology space.
I love the use of the word advocate because that is something that is such a valuable skill for anybody.
Hmm.
From the time that you are a brand new 18-year-old hitting the doctor's office for the first time by yourself and being able to advocate for yourself, and then just all the way through. I remember one of my very favorite oncologists, um, when I first started working with her, she was still of the mind that, oh, just eat anything to keep gaining weight,
Hmm.
eat a donut, if you want to, anything. And I was like, you and me need to have a talk, you know what I mean?
Hmm.
And so we progressed in our relationship to the point where she was such a supporter of food as medicine, and I just love that. But going back to the question, what does food as medicine mean? It's empowering. It allows you to take the reins on something that's such an important aspect of your being. And so to me, food as medicine involves not only culinary nutrition, so what to eat, but culinary technique, which is so valuable to self-efficacy, to be able to put into play the things that you're learning. Everybody is different. They come from different backgrounds. They come from different cultural They come from different abilities and resources. And so if you can provide education about food that is tailored to somebody's specific situation, then they are empowered to be able to truly make behavior change and put some of these suggestions into play. So that is what food as medicine means to me, is that you know what it is that is going to bring you health, but you know how to put it into play even more.
Yeah, and I think that's one of the most important parts that needs to grow, right? I think people can say, here, Brussels sprouts are good for you. But then how do you make that both long term, like you always want to eat Brussels sprouts and taste good? Like
Yeah.
that's a huge hurdle, I think, for people, for families, for kids. That is such an untapped need of, how do we cook again? How do you make vegetables taste good? That whole space is so interesting to me and so fascinating.
It's so funny. I am probably one of the only dietitians that I know of that really don't like the taste of vegetables. And everybody thinks that's the funniest thing when they hear about that, because they see me eating them all the time. But it took a process. I mean, I was not a vegetable lover. It tasted really strong to me. It tasted bitter. And I intentionally did so many different things to hopefully change my taste buds to the point where I do. And they're like, we see you eating vegetables all the time. And I'm like, I know that's because I made a huge effort to try to like them. And, just the process of hiding them in things and putting them in things that I didn't have to taste them right away, acclimated my taste buds to where I still can. But my husband still laughs at me because he'll watch me eating a fresh spear of asparagus, making an awful face, and he gets a real kick out of that. So
I have a question, Lexi.
yeah.
Speaking of this food as medicine approach and kind of like how you have, grown in your interest, like becoming a dietitian. You went to school to become a dietitian, but my understanding of that from what you've told me is that that doesn't take a functional medicine approach. It's a kind of your education is very different than what you had to learn in the additional training that you had to get to go into functional medicine, which really lends itself to the food as medicine approach. So can you describe that, like what your traditional education was, and then what functional medicine is, and how that kind of segues into using food as medicine?
That's such a great question. I had a professor once back in undergrad talk about the fact that becoming the RD, the registered dietitian, opens you up to go 30 different ways. And it's so true, because there's dietitians that work in the ICU that all they do is acid-base balance and look intricately at labs, or dietitians that all they do is manage feeding tubes or being fed through a vein in the neck. And so there's so many different ways you can go, and there's so much additional training that you can get to go to help you down your path. I knew going into dietetics that I wanted culinary medicine, that I really wanted to work around food. And one of the ways that I can get a lot of legitimacy, but also a lot of expertise in the field, is through integrative and functional medicine. And so I got additional training in 3 different ways. I went to IFNA, which is the Integrative and Functional Nutrition Academy. And I got a big old long title. It's IFNCP, which is Integrative and Functional Nutrition Credentialed Practitioner. It's a 2-year program that really runs the gamut of diving deep into all of the different functional labs that are out there that can help elucidate the medical nutrition therapy for different disease states. And so I got to look at nutrigenomics. I got to look at really advanced lab testing, stool testing, Dutch hormone testing, all of the different really intricate labs in terms of what is an optimal range. And just to give as an example, if you went to the ER and they were looking at just hemoglobin has a range that's pretty far apart, but the doctors wouldn't think it's a huge problem unless you were under 7. If you were under 7, that means you're ready to get transfused. You need a blood transfusion. But me as a dietitian, I'm an integrative and functional dietitian. I'm looking at a very optimal range, because if you are slightly low, you're not functioning optimally. And so what can we do to make you function optimally to keep you out of the hospital? So that's where my range really comes in. It's let's optimize, let's thrive, let's really get you to a great place of health. So that is the best place to fight disease.
Hank, it's just awesome. It speaks to, I think your experience with your daughter too, correct me if I'm wrong, led you to say, listen, you can throw all these medicines at us, but what are root causes, right? I want to move beyond symptom management, and I want to see what I can actually do to support my daughter's health, and looking at her as a whole person. And what it seems to me that functional medicine can do, along with culinary medicine, is look at really dig deep into the underlying root causes. And today go even deeper than we could ever go before, and then look at what sorts of foods, lifestyle, terrain kinds of things can support us in that journey, instead of just piling on symptom management, which seems to be, and then there's definitely a role for symptom management, and a need, like you said, for those medications, but you're taking a fundamentally, I feel like, deeper approach to this. And one thing that's really fascinating to me, starting out with Max, we he was diagnosed in 2011, and we got nutrition care from a PhD in nutrition that was offering services. And at the time, all she was able to do is look at any published studies and make an association to say, you try curcumin, try this, try, one substance, another, whatever, flavonoids, whatever. And I remember looking at it at the time, this must have been like 2012, saying, this has nothing to do with Max, other than an association to the diagnosis. There's literally no data on my son himself that relates to this. Like, she's not using any of that data, and it just felt very disjointed. Fast forward to today, we have a nutrigenetics program, which we can talk about. You can dig as deep can go at this point, and look at how the fundamental building blocks we're made of affect how we encounter the world, how we process various things, the sorts of foods and supplements that may benefit us, what may harm us. I mean, it's true precision medicine at this point, which I think people are not as aware of how powerful this nutrition therapy can be. And it really does come out of the functional medicine, looking at labs and the deeper things, like what is the composition of this human being, right? Not just what is this disease state.
You're just singing my song. It's your dialed, you said that beautifully, and you dialed right into the fact that we have all these different body systems, and they absolutely relate to each other. And then we have now at our disposal enough data to really support the idea of nutrigenomics, which is what you're speaking about. And so back 10 years ago, we didn't have the data to say that turmeric, curcumin was good or was not good individually for Max. Now we have the data to say that we know that hormones absolutely affect the progression of or not progression of cancer. We know that they also impact how we lay down bone health, how we lay down gut health, skin health, all of that, and the effect on our microbiome of all of these things. And we know that if you have a genetic variance in the way you process hormones, it can be induced or inhibited by curcumin. So we can take that particular patient and we can say, curcumin is a good choice for you, or curcumin is not a good choice for you. And so that is fantastic information, because we can really make a difference in the expression of our own genes, which then go on to affect the terrain, as you were talking about, the entire body and how it's functioning together as all parts to a whole. So you said it beautifully. And our curcumin is just one example. There are so many different things out there that, let's say, for example, how that affects mental health. So if everybody seems to have heard about MTHFR, so it's how the body methylates or puts a certain group on a neurotransmitter, for example, to turn it on or off. So if you have a slow methylation process, then methylated B vitamins are not your friend. But every formulation out there seems to have 30,000% of a methylated B vitamin. And so, which in case you could be making your mental health concerns worse. And so there's, I had a patient once where I was sitting at her kitchen table and I was like, so are you taking any supplements? And she starts bringing out a couple and I'm like, wow, okay. So I start to write them down. Well, she kept bringing them, kept bringing them. She once brought out 37 different supplements and had them on the table. And I was picking up random ones. Says, "Oh, why are you taking this one?" And she's, "I don't know. My mother-in-law thought it might be a good idea." I said, "Good idea for what?" And she couldn't answer the question. And so, there's a lot of competing voices out there telling you, take this, this is good for you. And, some of them are very well-meaning practitioners, but some of them are also marketing and trying to sell things. So knowing what is individually working for you is such a powerful tool to have that you can really make a difference.
Yeah, like what a gift, because some things are good for some people and not for you, right?
Yes.
And we're
Yeah.
coming out of a world of like social media education and things like that now, where very broad statements are made from people's platforms, right?
Yes.
Really broad.
Really
And
broad.
we can't do that. Like you can't say unequivocally, this particular thing is good for you. You don't know. And I think it's going to take us some time to catch up with that, because it may even be something that most of us agree is healthy.
Yes.
Right? Like even something like intermittent fasting.
Yes. That's a great case in point.
May not be
Dr.
actually
Longo,
great for everybody, right? Yeah.
Dr. Walter Longo out of USC, who's done studies for over 30 years on intermittent fasting. And one of the most valuable things to me in my practice that's come out of that is the difference in genders. The fact that for a woman, going longer than a 16-hour fast for a very long period of time can really affect thyroid hormones. And so, it might be more optimal to go 12 hours for a woman, especially a woman over the age of 35, 40, versus a man at different times. And it also depends, what the man's, nutrigenomic picture is as well. So,
yeah. That's really interesting too. It strikes me, we know, and so many researchers have been talking about this, like all of the research is done on men.
That is so frustrating.
Right. And not on women, but certainly not on children. When you think about it, right? So like the research isn't done on women, and then definitely not done on children,
Yes.
So
yes.
that's really interesting in our space working in pediatrics. I mean, I think what that leads me to is like the more data we can get, the better.
Absolutely. Absolutely. Dr. Dagmara Bainey just came out with a new book on pediatric oncology that I just got in the mail the other day.
Oh, nice.
Haven't opened yet, but I've listened to a few podcasts on her, and she's one of the few that treat from a MD perspective, pediatric oncology. But you're absolutely right. There's a lot of practitioners that don't have ranges available to them in the pediatric world for any of the recommendations that they're making. Right. And they're using weight-based recommendations. Right. But there are quite a few practitioners that do. So I try to stay very much up to date on the dosage requirements of all the different supplements out there for all the different ranges. We have recommended daily allowances on a good majority of the vitamins and minerals, but we only have adequate intakes on others. For example, choline is something that's incredibly important in the oncology space. And the adequate intake for choline is 300 milligrams for certain age ranges above 9 years old. But we know from a lot of other studies that the number is closer to 1,300 milligrams in order to prevent 300 is just the number to prevent organ damage. Well, what is the optimal number? Yeah. And what is the optimal number for somebody with a specific type of cancer? Is it less because of a choline-driven issue with the cancer metabolism? So there still is research that needs to happen, but I can't believe how many practitioners I've seen recommend phosphatidylcholine, which may not be a good recommendation if you have a specific type of cancer. So you may have genetic variances on the way your body produces choline, but that does not mean you're an automatic candidate for phosphatidylcholine supplementation. So there's a lot of nuances to some of these things. We can always achieve so much with culinary medicine. Eating an egg, your body can handle that really, really well. But when you're giving yourself a hyper dose or a pharmacological dose of something, is you can affect change with it. These are not benign substances to just take in.
Yeah, one fact what I learned from you, Lexi, was, and to go back to MTHFR, one of the biggest things you can do to help with that SNP is to feed your gut microbiome because
Yes.
there's bacteria in there that make folate active. Can you explain
Yes.
more about that? That's just like another example that came to mind on how culinary medicine can help some of these SNPs versus supplementing.
Yeah, there's a huge debate out there in the research world about the fact that we've dumped folic acid into everything, that we supplement, the cereals with it and everything else. And when your body processes a nutrient, it takes it into the body, it takes it all the way down into the cells, and then it makes it active. It changes the structure of a little bit in order to make it active so that it can do the job that it was meant to do. So it might go through 10 different chemical changes before it becomes this active, important nutrient. And so folate is one of those. If you bring folate into the body in its most natural form in food, the body can take it from folate all the way to the active form, this methylated folate form, in order to make new cells inside your bone marrow, in order to process new brain cells and activate certain end products that are important for brain health. The thing is if we dump in a synthetic folic acid through the middle of that program, it doesn't progress very well to that end stage. And so the most important thing we can do is take it in its most natural form as folate, or we can take it as that end stage product, that methylated folate. And so that's one of the things that's really important to body chemistry and how you eat folate. The other part is, what is your microbiome and what is the status of your microbiome? And is it doing its job and converting your food and nutrients to their most active form, and then communicating that back to your brain as well? For those listeners that aren't aware, the microbiome is a set of good gut bugs that do so many good jobs for your body. They help us process your nutrients, like we just talked about. They communicate with your brain and tell your brain all kinds of things, how to recognize things as foreign or safe, how to tell your brain things like whether you're hungry or you're full. It even tells your brain what kind of food you want. So the microbiome does a huge job, just like you were talking about. And one of the jobs they do is to help process the folate properly. And
No,
it
that's
binds
great.
to it as
And
well.
we can get more details I know we touched on it, but we're going to have Lexi back frequently to kind of address these larger questions that are relevant to our families. But I know you have some experience in GI, if I'm correct. Like you were trained a lot in the GI area, in the microbiome. Do you want to share that with our listeners, just your background in that area?
Yeah, and that goes back to my daughter as well, because that's what my daughter's issues were. She had she never had a diagnosis that they were able to hang their hat on. So those people who have a constellation of symptoms but don't actually have any other definable disease state by scope or by lab are given the title IBS, irritable bowel syndrome. And so it started with her. We did all kinds of different things. And then I was working at UC Davis Medical Center, and I got to help start up their EOE clinic, which is eosinophilic esophagitis, which is a really damaging disease that affects the inside tissues of your esophagus. And then when I came down to CHOC, Children's Hospital of Orange County, I was able to work in parts of the food allergy and GI clinic as well. And I worked with a lot of SIBO patients that way, but I did most of my training on SIBO patients, which is small intestinal bacterial overgrowth, in private practice, working for some of the docs that I work at in Orange County. They give referrals to me that way. And it's a lot of my training with IFNA that was able to give me the expertise to work in this area. But also I did some additional training on the side with different providers of that kind of training. And we really do, in the integrative and functional world, work with a program called a 5R program. And it has to do with, first, there are all kinds of different R's: remove, repair, reinoculate, revive, and then rebalance. And the whole program is such that we want to remove anything that's really irritating to the GI tract. And then we want to repair the gut lining. We also want to add back any nutrients that were deficient, because when you don't have a good functioning GI tract, you're not absorbing your nutrients well.
Mm-hmm.
And then we want to reinoculate. We want to get the good bugs back in there so that they can take hold and do the job that they need to do. We want to repair that gut lining, and we use a lot of lifestyle aids, but we also want to rebalance. So we want to really figure out root cause, which is
Mm-hmm.
such a beautiful thing about integrative and functional medicine. So why did the problem happen in the first place? And we can go back and we can figure that out, why that problem happened, then we can make sure it doesn't come back. And usually those types of problems are one of three issues. A, that you have some kind of problem anatomically wrong. A lot of our patients have had to have some kind of surgery that changes the anatomy of our entire GI tract, from mouth all the way through esophagus, stomach, intestines, and out of the body. So there's lifestyle things that you can do that can make a difference with restoring that proper direction of food. But it could be biochemical. When we go through chemotherapies and different
Mm-hmm.
things like that, you can change the way some of your stomach acid is developed or enzymes are developed. And so we can test for these types of things and provide that for a person if necessary. And one of the third thoughts is that we got some kind of a foodborne illness or some kind of an insult to our GI tract that messed up our microbiome. And we had an excellent talk given to us at CHOC by a UC San Diego researcher that talked about a huge percentage of our pediatric cancer patients, just through the act of going through treatment, have an
Mm-hmm.
insult to their microbiome, a loss of diversity and a loss of abundance. And so going through this 5R program can really improve things in that direction.
No, thank you for that intro. I think that's a huge space, with our population of these kids are going through really drastic treatments. And
Yes.
obviously one of the side effects of that is, like you said, the microbiome. And I know it's on a lot of parents' minds on how to help their child in that
Yes.
space. So that's really helpful, those 5Rs. And I think that's a larger conversation again that we can have in the future on, actionable steps that families can take to help that.
Yes.
Understandable side effects. So thank you for that background.
Sure.
Yeah, I think one of the things that we hear that folks really want to know are like recommendations, what we hear on like a basic probiotic.
Mm-hmm.
And I know it's something that we can get into with an entire episode, but I hear a lot about like people are getting a lot of advertising, they're getting a lot thrown at them. Like, what is just one basic child probiotic, like what are the basic strains that we need and things like that. And I imagine there's a challenge between sometimes people even taking too many probiotics or giving too many different kinds or not taking the right kinds. So that's something that I think would be really wonderful to explore, like the natural food opportunities. Like we used to give Max, we used to have him drink like the juice of our fermented sauerkraut. Like we give him like 2 tablespoons a day, of that. And if he wouldn't eat all the sauerkraut, it was funny. He didn't like the sauerkraut, but he totally was fine with the juice.
Good for
You
him.
don't get like the prebiotic and the fiber part in it, but we had such high fiber diets anyway that I think it was okay. So I think it'll be super fun to talk about like different kind of workarounds and different strains. And then we know that some of those strains might even relate to, there's like a spectrum here, right? Like what's the basic that most people could do if they haven't done nutrigenomic testing? But once you've done nutrigenomic testing, like you're able to tell us, there may be some strains that aren't great for us, like Sam and I with histamine overload issues. Like we don't do well with strains that produce histamine. And then there are going to be some strains that do really well for things like metabolic health, right?
Yes.
That we need to look at. So it's like such a deep and big like space. Is there anything that you could recommend to any listener today that they're like, okay, I can't wait for your probiotic episode to come out, your gut health episode to come out? Is there anything you could recommend today, like a book or a resource or a place to start?
Absolutely. And people would be surprised to find that I don't jump into probiotics right away. Because if you have major problems with your gut and you are not tolerating any of your food and you're really experiencing a lot of GI symptoms, you try to put good bugs back in there and immediately without doing any other actions, and they're going to die, create more trash, create more symptoms for you to deal with later.
Yeah.
So I usually, in that 5-hour program, it's not one of the first things I do. It's one of the second or third things I do. So that's usually a surprise to patients right there.
Yeah.
Everything you talked about in terms of, histamine producing antibiotics, if you've got a problem with histamine producing or in histamine liberators, and I have lists of those that are really important to either go for or stay away from. There's also probiotics that in and of themselves, by themselves, have in some situations, in some studies, done as much good as an antibiotic in specific situations. Like, for example, methane dominant SIBO, Lactobacillus plantarum has shown to be very advantageous for that. And there are quite a few, just like you mentioned, that are very good for mental health. Some are better for depression, some are better for others. And so there's a lot of data on that, absolutely. And I think as well is that stool testing is really advantageous to this area because it will give you a list of that commensal bacteria that you have, commensal meaning good for you type of bacteria versus pathogenic bacteria, which is bad for you. And it'll give you the idea of abundance on there. Like, for example, up until a couple years ago, there was one particular strain of probiotic, one particular strain of biota called Akkermansia that all of the researchers just loved. And it's like, okay, this is the great one. This was it's called a recruiter bacteria, meaning if you have abundant amount of that, it will recruit and keep around a wide diversity of good bugs. But researchers did not know how to bottle that and put it in a probiotic, and they have since figured it out. But again, if you have a gut that's really impacted by disease or just a situation, then going out and getting a bottle of Akkermansia is not going to solve your problems. You need to do some other steps first. Did I answer your question?
Totally. I mean,
Okay.
I think that's fantastic. And are there any like educational resources that someone could start with? Like,
yes, that was the question I missed.
There's a book.
Okay.
I know that there's a book called, I think, Good Gut, and it's by the Stanford lab that I've seen them present a couple of times. They have incredible presentations on their gut biome research. And I know that they did produce more of a popular book. Have you seen that book?
I have seen that book and I like that book. There is a new one, and we were just talking about that before we got on to the podcast today, that it's actually not that new. It's a little bit older, but it is now making its rounds in the in social media space, but it's called Hack Your Health. It's a Netflix documentary about the microbiome, and it's wonderful. It's really, really well done. When you first start watching it, you might think that it's a little bit on the funny side, maybe not that serious, but as you continue watching it, you'll see that it gets into all of the latest research and the impact of the microbiome on all the areas we've been speaking about: mental health, recognizing food as foreign or as safe for you, processing our nutrients for you, and performing actions with hormones as well. And so it's really valuable stuff. Really well done documentary.
Yeah, that's an easy one that families can watch. And that one, it touches on the stool sample testing that you mentioned, but not necessarily the nutrigenomic, which we talked about too. It would have been interesting if they layered that on there too. Yeah,
it would have. It absolutely would have. Yes, the way your body detoxifies nutrients
Hmm.
is also so valuable when it comes to having a good working microbiome. So the first part takes place in your liver, where certain enzymes work on toxins that are normal in our everyday occurrence. So just BPA from plastic water bottles, smog, the chemicals that are in your water. Your body takes all of those in and works on them in your liver and then releases them out into the areas of outlet in your body. And the biggest outlet is the stool, but also urine and breath and sweat as well. And so when we get into the microbiome, there's certain things that biota does in trapping some of those end products that the liver has gotten rid of and then takes them out through the stool. And so having that healthy microbiome is also a big part of detoxification. And both of those are managed and impacted by genetic variances in the body.
Yeah.
Lexi, I would imagine some people listening are like, okay, this stuff is so cool. They're talking about nutrigenomic testing. They're talking about stool samples, like testing, need to get access to this. And it reminds me, like, one thing that that my husband Justin always says is like, yeah, I could get all of that done for him personally, right? He said, but I know I could also really just follow a Fierce Foods, whole foods based approach and probably hit a good percentage of the things that I need.
Yes.
Just by doing that, like in the meantime. And here at MaxLove, especially with cases of, we do have a nutrigenomics program. We are getting into the supporting families with this testing. And right now we're limited because of funding to really focusing on high acuity needs. And I mean, if I could wave my magic wand today, we would be fully funded. Let's say Mackenzie Scott would say, MaxLove, what you guys are doing is amazing. I want you to be able to do this for all kids and families facing cancer, regardless of their financial status. So here's $10 million, go get it done. I'm waving my magic wand right now. Let's say we could do that. We would do it, but we are not there. And so there's going to be people listening to this that may not have access to some of the things that we're talking about yet. And this brings me to the fact that you are a massive author on our Fierce Foods Kitchen Cookbook. And you have been such a huge founding part of like bringing our Fierce Foods programs to a broader audience, bringing it into different settings outside of the hospital, in the community, children's museum, on the farm. We're doing all sorts of things to try to bring this out to a broader audience. So let's say our Fierce Foods Kitchen Cookbook is going to be available soon on Amazon. Hopefully, we are in the proofing stages, and that would mean it's going to be available worldwide. What an amazing resource. What can culinary medicine do for a family saying, I'd like to have some of these answers now, going with a book like the Fierce Foods Kitchen Cookbook, going through something like that? What do you think that could do for a family starting in culinary medicine? Does that really have efficacy, or do you have to get the testing?
It absolutely does. It absolutely does. There are so many things that culinary medicine can do all by itself. I know for me personally, just the fact that when I do the things that we write about in the book, when I do the things that we talk about in the class, in the classes, it makes a difference in my mental health. It makes a difference in my digestive health. It makes a difference in the energy levels. It makes a difference in my pain, sensory, joint pain and things like that. When your body is working optimally, when it has all the components that it needs in order to do the job, your body is amazing in its ability to detoxify and its ability to recover, to repair, to work optimally. And so just a matter of hydration, just allowing your body to take in enough water that allows your body's cells to take the trash out and take the nutrients in to fill up skin cells so they're plump and nice and protective of your body. I mean, just that basic thing right there goes a long way towards helping somebody thrive, towards helping somebody achieve the goals that they're looking for. I have this conversation all the time in private practice because these things are incredibly expensive and a lot of them not covered by insurance. My hope and desire is that with all of these resolutions that are passing, that a lot more of these things will pass and insurance companies will pay for them, because it's so much easier to do preventative than it is to pay for disease later. And so like Blue Cross Blue Shield is one of the bigger ones right now that is paying for a lot of preventative type interventions. But say, for example, I have a patient right now that the doctor suspects SIBO, and the doctor wants to get different tests done in this person's insurance particular situation. They're not able to do a breath test. They're not able to approve it. So these breath tests are in the range of like $350. What's valuable about them is that if you determine what type of SIBO you have, you can determine the most optimal form of treatment that will get them through treatment. But there's also a set of symptoms associated with each type of SIBO. So you can, there's pros and cons to this, but you can go in and go by symptom based and not get a SIBO test and run through the gamut, the whole 5-hour program, but also a specific set of, so for example, they use a common medication called rifaximin. It's an antibiotic, and it is effective against all 3 types of SIBO. But if you suspect that you have one type over another, you layer in other things that help SIBO to eradicate quicker. So if you don't spend the $350, if you can't spend the $350, you can go in based on symptoms and clinical judgment and work off of it that way. Of course, it's more optimal to know what you have for sure and be able to test it at the beginning, do the treatment, and then test again and know that it's gone. That would be the most advantageous way to do it. But you can also go in with symptoms, but throughout the entire process, almost everything that's in the 5-hour program is diet and lifestyle, is what's in our cookbook, is the 8+ servings of fruits and vegetables a day, is the lean proteins and the high quality fats, because all of that is going to make your body work optimally. And your body is designed to beat disease when it's given the tools to do so. And what's in that cookbook is going to give you the tools to do it. So in answer to your question, it is very frustrating, and it's frustrating for a lot of people that this really valuable information and testing can shorten up the time it takes to figure something out. There's guesswork involved without it. But at the same time, this guesswork is based on clinical judgment and is based on, these people with this particular issue have these set of symptoms. Let's go in and treat and see if we can make a difference that way. And you can get by with that. It's better if you can have the test, but you can still do it without it.
Yeah, I think that's incredibly helpful. I mean, to know that taking our fear shoes approach and applying it to your family to the extent that you can, and even just getting started with it, even in the baby step, really helps. Like, baby steps add up. And they really do have effects, like lifelong effects. I really feel like, I've seen it with my own kids starting, being able to start with this approach. We, I think felt like we had to, like, it was an opportunity that was extended to us through what Max was going through. But, I still see it paying off today when I see my kids make food choices. I still see it pay off when I buy flats of raspberries and they're gone instantly, and like, it's just amazing to witness that. And I think it's such hard work coming through the standard American diet and what we have access to around us. Like, I see it living in Georgia now. It's even harder than in California, where I could choose almost like a fast food option that was healthier. There's a place where you could run in and get a salad, or a place where you could get a cleaner protein. And I totally get it. Living where we do now, it's not that easy, so it can be challenging when that's the food environment around you, but that's the power of culinary medicine. And what Sam, like what you were saying before, that's the power of the deliciousness of it. That's the culinary part of it, right? That's the part of it where we're like, we have fun with it. It is appealing on so many levels. It's like completely tasty and delicious. So you're not sacrificing. And we try to help with that. And a part of it is like flipping a script from a narrative of depriving to a narrative of providing. And that is a change, that is a change when you think, oh, I'm limited, to opening up to saying, no, I mean, look at the possibilities, with a whole foods based approach, and trying to just stick to foods that are like as whole as possible. Right. And working with that, even if it's a percentage of the meals you choose.
Right.
I have a friend who's also a dietitian, and she was telling me about just a really heartbreaking story of a client that only has access to fast food every day and eats like 3 burgers a meal for each meal in the day. And just how devastating it is for her health and for the patient's health. And that the doctor took out here, it was in the South somewhere, took a year to provide a dietitian consult. Didn't think it was related.
A problem. Yeah.
Didn't think the person's health concerns were related, and it's just so heartbreaking.
It is heartbreaking.
So we try to provide that square one. What are some easy first steps, even if it's first exposure, like even if it's just like, trying something for the first time, maybe you may not replicate it, you may not do it over and over again, but even if the child says no, don't like it, but they tried it, they got exposed to it, isn't that of value? I mean, you've seen in your practice that just initiating that in the family does build to something.
So much so. I think too that also the component of that's incredibly valuable is the not looking at it as a judgment either, and not feeling condemned if this is your starting place, and we're talking about like maybe this is your starting place and we're talking about going over a complete 180 or something like that.
Right.
Can be very, very intimidating for people. I've had moms speak that to me in class, saying, pull me to the side and say, I love what you're talking about, but we're just so not there. We're nowhere near there. What do you suggest as like a first step? And everything you just spoke about is that. And I hope to always provide an environment where people don't feel judged when they come in the door, because that's where we're at in this world. That's the food environment that we have in front of us. I just gave a talk the other day about how to hang on to your health goals when you're on vacation. And I talked about the fact that, if you're in an Airbnb, it might be a little bit easier because you can shop. If you're in a hotel, it's harder because you have, you may only have access to the restaurants or the cafes or the little market stores. If you're in a food desert and the only fruit and vegetable that you have available is some moldy kind of apple sitting on the corner of the 7-Eleven, you know what I mean? What are your options here?
Right.
And so we talked about everything you're talking about in terms of not letting perfection be the enemy of the good. So not saying that you have to be over here today. It's that exposure, that thinking about what your opportunities are, where you can find different things to get and change by degrees. So if you're at that 7-Eleven and it's only the moldy apple, maybe there is a little bag of dried fruits and nuts that is over, and that would be better than the candy bar or the donut or the, hot dog that has been sitting there for 5 days, type of thing. And so that would be one of the areas that you could change. Most fast food places, at least a couple of years ago, they tried to come out with some healthier options, tried to come out with a salad as well. And so even if it's something like grabbing that burger, but you're not going to put the buns on it, you're going to lettuce wrap it. Almost all places like that are lettuce wrapping it these days. Then you get rid of that crap carb. And even though I wouldn't call romaine lettuce fabulous, it is food for your microbiome. And so that can make a change right there. We know in so many studies that incremental changes make those incremental changes in the microbiome. So using that exposure, using that information, and even if you're not in a food desert, if you just had a child that is incredibly impacted, their taste buds are incredibly impacted,
Mhm.
their nausea, their, all the symptoms of chemotherapy and things like that, they are just not having it. They are just not having more than 3 beige foods, and that's all that they will tolerate in their existence. There's so many different things that you can do to start edging toward that. We've had kids in our classes that, they started with us in that phase, and then 5 years later, they're willing to try. And so that exposure is incremental, and that is that intention of bringing your child to the fierce food class, or bringing your child to the farmer's market, or bringing your child to wherever it might be that they can be exposed to some of these things. And of course, we've talked about this before, but that 5 stages to acceptance. So allowing it to be in your environment is number one. So trying to make that good food and people talking about good food in your environment just gets those thought processes going, and then smelling it, and then allowing to touch it. Even all of this starts before putting it in your mouth and having that taste. And I tell kids all the time, they say, no, I don't want it. Do you want to smell it? Do you want to see what? And then the curiosity gets the better of them, and they'll be willing to come in for a smell. And then maybe it might take 2 or 3 or 4 times before they're willing to even take a lick. And I tell them, I don't care if you spit stuff out in my class. I am 100% fine with that, because it gives them the confidence that I'm not going to make them swallow something and not trust it, that they're not going to like. And so I'm okay with you licking it. I'm okay with you taking a bite and then putting it in your napkin. You know what I mean? Giving that non-judgmental environment where kids can try things and a safe place where they can be exposed to it is huge. And so I think it's incredibly valuable to do it that way. And I think that kids will absolutely get that way. I know with my own child that, you know, she was eating the 5 foods because everything hurt. Everything she ate hurt. And we go to a dietitian. The dietitian's like, she needs to eat broccoli and she needs to eat fish with bones. And I'm like, my kid is eating, like a frozen waffle, and that's the only thing she'll tolerate with a little bit of peanut butter, and I'm thinking, I'm never going to go from that to fish with bones. You know what I mean? That's just not going to happen. But it was just getting Julia involved in the process, getting she and I would make purees of different fruits and vegetables and get them in things like spaghetti sauce. And then she would tolerate it that way. And now, I mean, she eats everything. So it took a long time. And it also took a period of time once she went off and moved out of the house where she was like, I'm doing my own thing. You know what I mean? But then it came back to her. And so sometimes it is a process. And sometimes you have to take a multivitamin because you can't get there. You know what I mean? You need to be nutritionally replete, but so there's different things you can do absolutely along the process. But I think not letting perfection be the enemy of the good, and baby steps is huge in that regard.
I feel like that needs to be the title of this podcast.
Yeah,
Because I think it's an important point that I think we hear from families too, of like, we're big advocates of culinary medicine and food as medicine, but knowing where you're at and giving yourself grace through it all is almost more important,
we know that you can make
anything.
changes in the microbiome in 3 days. We know that you can make and introduce bugs and keep them there just by adding one single thing. So if it's your one single thing for the next month that'll make a difference, you've already made a change.
Yeah.
I love that.
One thing to touch on too, and what comes to me, and something that we've talked about with families too, is, we're talking about the changes with your child and introducing them to things. And what comes to mind too is the power of the parent, also making those decisions, and also being, bringing them to farmers market, seeing what you're eating. And I don't know if you want to touch on like that cultural family change. I experienced it with my family of, if we're changing my daughter's diet, I took that on as well, because I saw the power in, mirroring. And I know, Audra, you saw that too with Max, of the power of the family unit almost around culinary medicine and the food. I don't know if you want to touch on that too.
I start laughing only because I think of that look on my face when I'm eating the asparagus, and what my kids are watching when they see that. But they also saw my intentionality with the fact that they knew I didn't like the taste, but they knew I was doing it anyway and figuring out a way to make it work for me. And so I think that they're one of the guiding principles that I use when I think about, parent and child responsibility is that you want to develop that good relationship with the food in a
Mhm.
child. You don't want it to be the parent sitting over the child, saying you have to eat this and you have to do it this way. And so Dr. Ellen Satter is a renowned author on the subject, and she created a principle that is so simple, and it's just that parents decide what and when, and the child gets to decide if and how much. And so and this is to be used if you don't have a severe situation. If you have a child who's malnourished, then you have to use a different tactic. But this is for kids that are not in the danger zone in terms of weight and nutrients. But it's that I'm going to put on the table right now for breakfast. I'm hopefully going to include something that I know my child will eat and love, but I'm going to put what I consider to be healthy. And I'm going to say breakfast is at 8 o'clock. If the child decides to eat, the child gets to decide how much, because that establishes the child's control over that they can control their own choices and that they can be in control of their food versus the food controlling them, which is so important to the establishment of good habits and a good relationship with food. But then if the child decides they don't want to eat it, that's fine. There's no battle, there's no drama, there's no angst over it. Next meal is at 10 o'clock. We're having a snack, we're having, hummus and crackers or hummus and carrots or whatever it is we're having, and maybe a piece of fruit. And if the child decides not to eat it again, well, if we're having lunch, I'll put this in the refrigerator and we're having lunch. But the parent decides what choices go on the table. And that takes a lot of that battle out. And sometimes it takes a while before that happens. And if the only thing that child is eating is peanut butter is not a terrible food. It provides protein, it provides some vitamin E, it's got some fat in there, it's got some protein in there. And so trying to work through the rest of the things that encourage the child to have more diversity in the food will come, especially, like, for example, there's so many different chemotherapies that make zinc deficient in the body. And so if you do some nutritional testing and determine that zinc is low and then replete that, those things will go a long way into helping a child's taste buds open up as well. So knowing some of those things and knowing to be able to ask for some of those things from your team is really valuable and allows you to make change that way too.
I think that's incredible. Lexi, you've talked about that plan before, and I think that's like such a beautiful framework to use, right? The child is empowered in the choice to eat or not and how much. The parent provides the meal. There's no like shadow meals. There's no like one family meal and kid gets another kind of meal or whatever. And what a wonderful agreement. And I think the challenge that a lot of parents have, like we slide into this way of just trying to provide whatever the kid will eat, because I feel like when they're babies, I remember the acuity and the high stress of feeding them.
Mhm.
And then when they're in treatment again, it sort of resurfaces. And it's like, those same feelings are coming up of like, oh, my baby has to eat. Like, we're built for it. Like,
I'm not doing my job. I'm not doing my
right,
job. They're
right.
eating. Yes.
Yeah, it's so important. And so this provides a framework where the parent can feel safe. My child will be safe. When they're hungry, they will eat.
They will. For most intents and purposes, they'll eat. Again, if there's something biochemical going on or there's something,
right,
that's impacting their ability to eat, like nausea or vomiting, things like that, of course, we need to do
tube feeding,
much more.
And there's like, a number of other circumstances.
Even if it's just as simple as Zofran or something like that, then we do that. There also is all kinds of culinary medicine to reduce nausea, and we speak about that in the cookbook. So there's things to do, but for your behavioral, I mean, when you throw up for 15 days on all of your favorite foods because that's what everybody's giving you, and you come out of the hospital with, I'm only going to eat these 3 foods because it's safe, that is a mental strong driver of choice. And so it takes repetitive action, it takes encouragement, and it takes a good length of time in order to rework through that. And when the mom has a lot of angst about that, it hurts to put that angst into the decision-making process as well. If the mom has confidence that you're going to eat when you're ready, you know what I mean? That takes some of the stress out of that interaction. But here, let's try it again. Come on, we can try it. Smell it if you don't want to take a taste, you know?
Yeah.
So
I love that, Lexi. And with the few minutes that we have left, I do have another question, because we've been talking about testing, we've been talking about micronutrients, we've been talking about, a number of like more nitty-gritty things, supplementation, stuff like that. What about like macronutrient profile? We've been talking a bit about fiber, but I am interested to hear what you think in a kind of like fierce food style, whole foods based style for general health and wellness, obviously not a prescription. One of the things that comes up for us with families is they hear various different opinions on protein. Animal protein is good for you or bad for you. Usually they're hearing that it's bad for you. How much protein for a child? What does protein do in the body, right? And then, of course, carbohydrates. We're going to hear various ideas on that. And I feel like fiber should be considered its own, like macronutrient, but whatever, like how does that factor in into the diet as a whole? And then, of course, fat. We've been going through all of this, strife over the years of fat. What kind of fat? So what are your thoughts for child health and wellness, specifically on these macronutrients in the diet?
I think in every meal that you sit down to eat, there should be a balance. There should be protein, carbohydrate, and fat in every meal. I think that whenever you restrict the diet and when you take out entire classes of nutrients, so for example, if you're plant-based or if you're keto or if you're paleo and you're excluding complete sections of food and food groups, that more intention needs to be made in order to make the diet whole, to make sure that there's adequate nutrients in each category. And so, for example, if you're plant-based, there's vitamin D, there's some other nutrients like B12 that absolutely can't be achieved through a vegan or a plant-based diet. And so you need to be intentional about how you get them. I think the same way of a ketogenic diet, whereas there is even the most well-planned ketogenic diet could still be potentially deficient in certain different nutrients. So that if you undertake a therapeutic keto diet, you should do lab work on an annual basis to make sure that there's not a little bit of extra that needs to be delivered from a supplement. I think that for plant-based diet, I think that if you could incorporate some fish in there, that would help to meet some of those categories, and it doesn't have to be exclusive unless that's your thought process. If your thought process and your desire is to be exclusive in one of those areas, it's just important to educate yourself on what could be lacking so that you could make up those nutrients elsewhere. I think that the way our food is processed in this country matters, and that attention should be paid to how your ingredients are grown or fed, because it makes a difference in the nutrients that are laid down. So for example, with a cow, if a cow is grass-fed, it's going to lay down less saturated fat and more omega-3s than a cow that is corn-fed. And there's other nutrients, CLA, conjugated linoleic acid, things like that, that are going to be lacking depending on the way that that cow was raised. Same thing with fish, but also same thing with plants. If your plants have been, like, for example, wheat is not genetically modified in this country, but at the same time, it's sprayed with glyphosate in order to desiccate it, to have the hull removed from the wheat. And that is really damaging to our microbiome. And so if you have the privilege of being able to buy food that is labeled as such, making those choices as possible. If you don't have the privilege to that, your body is still miraculous in its ability to extract the nutrients that it needs to. So if you can focus on getting as many of the fruits and vegetables in as you can, you're still going a long way, even if you didn't get to pick the way that that particular plant was grown. And so those are some of my philosophies. Again, don't let the perfection be the enemy of the good, because your body can progress and extract some of the stuff that it needs, and you're still going to be doing a lot better than the person who is only eating a hamburger 3 times a day from a fast food joint and not getting anything else, no diversity other than that. And so so there's things we can do in each of these categories, meet you where you're at, and try to be aware of your food choices from then on out, and try to educate yourself. You know, read the MaxLove Connect website, because there's tons of information on there in terms of food choices, food quality, but also just trying to get in and be aware.
That's great. Thank you so much, Lexi.
You're very welcome.
Love that.
Good.
Do you have any follow-up, Sam? Oh, I think your sound went out. Oh,
sorry, I had it on mute.
Yeah.
No, I think that's great. I think like we said in the beginning, Lexi's just a wide array of information, and she's invaluable to our team and our families. So, I think we did a great job on touching all these little nuggets of expertise that you have. And I think what I'm really excited for, what our families could bring question-wise that you would be opening to, diving deeper on. I think it's an invaluable resource, having somebody like you who's so well versed in the science, so open-minded too in what a family is coming from, you being a parent yourself in that space. I think it will be a great series as we go on in this podcast.
I'm excited. Let's do it.
Let's do it. I can't wait. So I think the next 2 topics we have teed up are bone health and probiotic microbiome health. So 2 really, really big topics coming up. Yes. And if anyone wants to know more about our nutrigenomic program and your MaxLove Project parent, childhood cancer, rare disease, in MaxLove Project Connect in our app, we have an amazing course that can give you an orientation about that. So that you can, come to understand what nutrigenomic, the entire project is, before diving in further. And then we have a Fierce Foods course. We have a keto course. We have a tube feeding course. We have a medical cannabis course. We have an entire lifestyle medicine collection of courses. So we have a lot of great opportunities within our e-learning platform to learn more. And then you also have the opportunity to ask more questions. And as you ask questions in the app, we bring them to Lexi, we bring them to our experts. So we have, I think, incredible opportunities to dive deeper in and to do the critical learning needed to be able to do this work. Because at the end of the day, I really feel like the parent, you're the only one who knows your family dynamic, your culture, your background, what you can achieve considering everything that you have going on. You're the only one who knows your next steps. You're the only one who can identify these clinical symptoms that you're seeing, in your child in the moment that then you're reporting out to so you really are the critical piece for your child, your children, your family. And so we work on empowering you with as much information and access to resources as possible. So here's to many more conversations, Lexi.
Let's do it. I'm excited.
Awesome. Okay. We'll see you all soon.
All right.
Okay. Bye.